SickKids Hospital says that it's seeing an increase in children with serious injuries from e-scooters or e-bicycles. The hospital says in June and July, there were 16 injuries related to e-scooter use compared to 5 injuries in the same 2 months last year. And for more on this, we're joined by Dr. Suzanne Beno with SickKids. Dr. Beno, first off, let's just talk about what you're seeing in general.
Yeah, absolutely. Thank you for having me on to discuss this. We have seen a notable increase in micromobility device injuries this season. As you pointed out, 16 in the space of 2 months, whereas last year we saw only 5. And the injuries are severe and significant, and we wanted to bring attention to this so people understood that this is a problem, particularly for young adolescents, children and young adolescents who are on these e-scooters.
Okay, Dr. Beno, I was looking at everything, and it says that, about half of these cases, the kids are not wearing helmets. Talk about that effect and what change that could have if they actually start wearing helmets.
Yeah, no, that's a super important statistics we've seen. So 56% of these kids who present to the emergency department haven't been wearing a helmet. And actually, of the children who are more significantly injured, who've required a trauma team activation, for example, the majority have not worn a helmet. So helmets do protect against moderate to severe traumatic brain injury, and we encourage that they are always worn, appropriately fit, and worn consistently without exception.
Okay, aside from the helmet use, or lack thereof, rather, what are you seeing when it comes to, when these patients come in for these, accidents on these e-bikes?
Yeah, we see a range of injuries. So you can see sprains and strains and fractures. Most commonly, we see head injuries. We have seen a cervical spine injury. We've seen chest and abdominal injuries with, internal bleeding, significant fractures, as I mentioned. So some of the kids really do have very significant and sometimes life-altering injuries. So because this season we've seen such a notable increase, it's really important that we put that awareness out there so that there are some rules of the road, some safety precautions that need to be followed when utilizing these devices.
Yeah, along those lines, talk about, I guess, the impact when you're using something that is electric versus manual.
So the impact is, speed, and often, they're very efficient. There's a bit of a thrill to them. There's a lot of positive benefits for them. However, traffic is always a hazard, and it's a significant hazard, particularly when you have young, inexperienced riders or drivers who are on these devices who may not be able to properly navigate these within traffic or respect the rules of the road necessarily, or who aren't using the safety precautions like helmets and so forth. So our big advice, of course, is to understand the rules and regulations in your municipality, because they're different and they vary, and respect those, to ensure that safety equipment like helmets are always used, that parents are having conversations with their children about safe riding practices to ensure they have situational awareness, that they're maintaining a safe speed, that they're aware of their surroundings, and to use quieter streets if they're going to persist. And really, we don't encourage children under 16 to be on these devices. They're not designed for children and young adolescents, and our highest rate of injuries are actually in the 10 to 13-year-old age range.
Okay. Dr. Suzanne Beno with SickKids, thank you very much for your time.
Thank you for having me. Take care.